Welcome to the library's Lunch and Learn session on Nursing Reference Center. The Lunch and Learn programs are an ongoing series of mini lectures on a variety of research-based topics and databases. Please check the Lunch and Learn page at library.rrc.ca for a full schedule and for more information. Let's get started. Nursing Reference Center is the premier evidence-based information resource designed specifically for nurses. It improves quality outcomes, answers clinical questions, improves nursing skills, and supports nursing research. It contains nearly 4,000 evidence-based care sheets and quick lessons, more than 2,300 nursing skills and skill competency checklists, as well as numerous cultural competency sheets. Nursing Reference Center is an EBSCOhost product and is closely related to the CINAHL database, which is the Cumulative Index of Nursing and Allied Health database, in that it also contains CINAHL articles. Nursing Reference Center has a lot to offer to nurses, nursing students, and faculty, including quick lessons, evidence-based care sheets, 2 drug guides, as well as full-text ebooks. NRC is geared specifically towards nurses, as opposed to UpToDate, which is geared towards physicians. You can access Nursing Reference Center 24/7 from the library homepage. Click on the orange tab to be taken to a list of our articles and databases. Then click on N for Nursing Reference Center. This is the home landing page for NRC. In this session, we'll be exploring the various purple tabs across the page: diseases and conditions, skills and procedures, drug information, patient education, and practice resources. We will not explore the continuing education tab, as that is more geared to nurses in the United States. The spotlight area highlights resources of interest within NRC and gives the editorial policies of the database. The Nursing Procedures section gives quick links to the new procedure sheets. And at the very bottom of the page, you can click on the link to receive instructions on how to install NRC on your iPhone or iPod. On the Diseases and Condition tab, you can search by disease or condition to get clinically organized nursing overviews designed to map the nursing workflow. In this example, we are looking for information on treatment adherence for a patient with COPD. There is an evidence-based care sheet for this topic. Simply enter COPD and select the appropriate topic. Evidence-based care sheets are great, usable, concise information with the subtopics of what we know, what we can do, what do we tell the family, as well as other references which you may want to explore further. Once you have located an evidence-based care sheet, you can print, email, save to file or folder, just like you would in the CINAHL database. Saving to folder is only good for the current session, unless you have created an account within EBSCOhost and have signed in as yourself. You can use the same account for all EBSCO products to keep items in your folder permanently. Alternatively, you can email the item to yourself, and that would give you the resource in a PDF format. It would give you the permalink as well as the citation in APA format. It is very important to watch your capitalization in the EBSCO citation. This citation is still in the 6th edition of APA. In the new 7th edition, it is no longer necessary to include the phrase retrieved from. With any online citation tools, it is important for you to refer back to Administering the Right Care Style Guide, which was provided to you when you began your program. This document contains very good examples which you can refer to for any citation questions. On the Skills and Procedure tab, you can search for a topic by entering a keyword or by browsing the alphabetical headings list. Included are clinical papers detailing the steps to achieve proficiency in a specific task, including checklists. There are also several cultural competency documents which may be helpful when dealing with patients from various cultural backgrounds. The Drug Information tab contains 2 drug guides, both of which are American-based. The first is the Davis Drug Guide for Nurses, and the second is the AHFS Drug Information Essentials. Both resources are searchable by either entering a drug name or by scrolling the alphabetical list. In this example, the drug salmeterol has been selected. You will be able to access a pharmacological profile of the drug, adverse reactions and side effects, as well as nursing implications, as shown here in the table of contents on the left. Patient education sheets can be searched by keyword or by topic and can be browsed by scrolling through the alphabetical list. Patient handout sheets are evidence-based and are available in English or Spanish, which may be helpful to you. They are in easy-to-read format for the patient and may contain detailed medical illustrations, definitions, causes, treatment information. In this example of a patient education sheet on breast cancer in women, there is information for the patient on the various imaging tests. Tests like mammography, CT scan, and PET scan are all hyperlinked and are clickable for further information. Under the Practice Resource tab, there are several manuals or ebooks that are available to you in full text, including the Davis Drug Guide, the Taber's Cyclopedic Medical Dictionary, and Davis's Comprehensive Handbook of Library and Diagnostic Tests with Nursing Implications. Some other titles available to you are Psych Notes, Understanding Medical Surgical Nursing, Nursing Care Plans, and the Nursing Diagnosis Manual. You can access the full text of the Medical Surgical Nursing 5th edition by clicking on the book cover icon and then by clicking on any of the individual chapters listed on the left. You can also search within the publication for a specific topic. And finally, the Nursing Reference Center can be downloaded to your iPhone or iPad at the URL shown on your screen. Thank you for attending this Lunch and Learn session. If there are any questions, please do not hesitate to contact us. You can contact the facilitator of this presentation by email or go to the library homepage and click on the Ask Us button to open a chat with our library staff. Thank you for attending. You can check our library homepage for further sessions. Thank you.